Moriac is a regional town 25 kilometres west of Geelong in Victoria. About 600 people live in the township and the closest medical facilities are half an hour's drive away. But thanks to a partnership between the Winchelsea and Anglesea Community Bank branches and Hesse Rural Health, a new medical centre worth almost $500,000 is under construction.
The asset's actually owned by our community company, Corangamite Financial Services. We purchased the land, we're responsible for the construction. We'll be leasing the property back to Hesse Rural Health at a commercial rental income. So from that perspective, it's an asset on our balance sheet and also income generating and also a community asset at the same time.
The community knows what it needs. Often they need to work with other levels of government and other business or community groups to make things happen. So really this has been a grassroots initiative. The community have said this is what we need, and they've worked with Hesse Rural Health, they've worked with the community bank, and they've consulted with the Shire, and what we've ended up with is a great facility that will benefit the local people.
We've been pretty lucky that the bank's come on board to enable us to do that, and probably without the bank's support, it probably wouldn't have got off the ground.
The new facility will introduce the permanent services of a GP and other specialist practitioners to Moriac, which will make life a lot easier and hopefully healthier for local people.
Well, they'll see an on-site doctor for probably a few days a week, and then alongside that will be a community health nurse and allied health. So there would be people like physiotherapists perhaps coming into the centre to work here as well.
At the moment, people of Moriac have to go to Geelong or to Torquay for medical services. So this is great. Now a family with a child who's sick can go straight round the corner to the medical centre.
I think it'll be good for the community, and if you need to go to the doctors, it's not so far to travel, and good for young kids. It's a young community, and there's going to be, it's good for everyone, I think.
The Community Bank Company has also supported Hesse's $2.7 million dementia wing in Winchelsea, underwriting a loan and contributing more than $100,000 to establish the service.
It's a non-clinical environment that's been created to suit the needs of country people and reflect the, the cultural upbringing of those country people. So it has for its own little farm, for example. It's got its own farmyard, stables, shed, ute, tractor, all that kind of stuff. In fact, the clients there will even see sheep being shorn.
We've been well supported here by the community in Winch. We were one of only 3 community banks before us to get to $20 million in banking business within a 6-month period. We reached a break-even point within 8 months. Community support in the form of banking business allows us to generate these community outcomes.
The next project for the Community Bank Company and health provider is to introduce childcare services to Winchelsea.
We're actually trying to look at a project called intergenerational living, where aged and younger people actually share facilities on the same site. So childcare will actually come in under the roofline of this, and people in the aged care environment will literally walk down the corridor and come across their great-great-grandchildren.
Since the Community Bank Company opened its first branch in 2003, it has returned more than $400,000 back to its local communities, a strong indication that this is not just another bank.
I think the community bank plays an important role in breaching a gap. The Shire can actually supply funds, and we have state and federal funding, but really you support your local bank, and this is a bank that's giving back to the community. It's
extending beyond returning services to communities that have lost community banks and onto community outcomes. We hear from the community bank department that they're actually getting inquiries now and have established community banks in areas that are well serviced by the majors, but the community actually wants the benefits of community banking, and this is what it's all about.